As we know, our local hospitals are hitting max capacity with a large number of COVID-19 patients. How is this impacting the blood supply and the need for convalescent plasma?
It's made a huge impact for us. As we know, like you said, all of our hospitals are really hitting max capacity. The majority of those are COVID patients, and a lot of those are needing convalescent plasma. So the requests for convalescent plasma have really skyrocketed in the last couple of weeks. We have sent out 650 convalescent plasma units in the last 14 days, which is a huge number, and we only anticipate that to grow. We've been predicting this since the beginning of the pandemic throughout. Overall, we've sent a little over 3,300 units out locally to our community hospitals. We've also been able to send a little over 1,000 products out nationwide. We were able to do that throughout the pandemic because the local usage was lower and we had extra on the shelf. We are definitely not in that situation now, with 650 being requested and used just in the last 2 weeks. We need to ramp up our supply ASAP. We've also only had 484 donors donate that convalescent plasma. So when you think about that, 484 people through all of our tri-state area, when we know the positivity rate is, going up and up and up, we know we have a lot of people eligible to donate convalescent plasma, and that's really what we're looking for now to increase our supply going into the next few months, when we think it's just going to continue to rise for the need that the hospitals have.
So how can people help?
So we're looking for people who thought they had COVID, who have tested positive for COVID. We're also providing antibody testing. So if people are testing positive for those antibodies, we're actually able to use that part of the plasma donation right then and there for a convalescent plasma product, which has been huge for us as well. We're also notifying people if they test positive for the antibodies. We're notifying them and asking them to come in to donate convalescent plasma if they can, and as soon as they can. 2 reasons for that. We know we need it right away. The need is, like I said, only going up. And their antibodies are usually higher the sooner after they test positive or we see those positive antibodies. So the sooner they can come in, the better donation we're going to get. That's going to be a better product for that hospital patient. So we're asking people to reach out to us if they're interested in donating convalescent plasma for COVID-19 patients. And we would love to chat with anyone throughout our entire area.
And how exactly can these people get in touch?
If they go to lifeservebloodcenter.org, we have a whole page about convalescent plasma, a form that they can fill out. We also have a contact us page on our website. They can reach us there. They can reach us on all of our social platforms as well. Or they can give us a call at 800-287-4903. They can also text LifeServe to 999-777 and chat with us. And we would love to connect with anybody that is in our region that thinks they had COVID and think they'd be a good potential donor, because like I said, the need is just going to continue to rise. And donations with community blood centers are the only donations that are going to help our current COVID-19 patients in our hospitals across our state and Nebraska and South Dakota.